In the last decade, the whole world, including Europe, has been suffering from synthetic drugs. College student jumped off his dormitory floor because he thought he was being chased and ended up losing his life. Our success rate is more than 70%. Now, internationally, therapeutic communities have a success rate of 20 to 30%. Our emotional world needs to be very well protected, and we can't play with fire.
Welcome to the Med Conceptions podcast, a podcast about health and living a more mindful life. Today, I am very pleased and thankful to have with me Tina Pavlou, who is a clinician, who's a clinical family therapist, a clinical director at the Therapeutic rehab Community of Agia Skepi in Cyprus, and a mother of 4. She has over 25 years of clinical experience in the field of drug abuse and addiction. Today, we're going to try and address addiction and drug abuse and try and debunk some myths around the subject. Thank you so much for being here, Tina.
Thank you for inviting me. It's a pleasure to be here.
So what I usually do is we start with a little bit about what you do.
So I've been working at Agia Skepi for the last 24 years. Agia Skepi is the largest organization dealing with drug addiction in Cyprus. I have a small private practice on the side. The last 10 years. I've taught at the University of Nicosia for 5 years, and I've been on the parole board the last 6 years. So I work a bit at the prison, evaluating long-term prisoners that are up for parole.
It's lovely. How did you come about to, what interests you to go into all these fields?
Well, I specialized in addictions back in my graduate degree. And my first addiction class, which I took a bit randomly, to be completely honest, I was looking to do my practicum hours for my first practicum, and I was looking for a paid internship at the time due to financial restraints. The only paid internship in Washington, D.C. at the time when I was in graduate school was in the field of addictions. I gave it a shot, and I fell in love with the field. I was fascinated by the fact that drug addiction, which is a field that touches every single person on this planet, is directly related to emotional pain and suffering. And since I had gone into psychology and wanted to work with less privileged people, I felt that it was a great match for me. My first class in graduate school in addictions, I remember it was this African professor. He walked in and his first sentence was, "You're very wise, those of you who have chosen addictions as a specialty, because wherever you go in the world, you're going to have a job." And I remember thinking, I wonder if Cyprus, if there's any, if there will ever be a substance abuse issue on this island. Because back then, it was unheard of almost, which was really a problem hidden under the carpet at the time. So, years later, I come back to Cyprus and we start the first inpatient rehab facility on the island. And it's been going on for 23 years now. We're running 6 different programs. And we cater for the long-term drug abusers that have been using drugs for many, many years on a daily basis. So it's a specialized population within the substance abuse field.
And this addiction center or rehab center, it's called
Agia Skepi. It was created, it belongs to the monastery of Macheras. And it was originally, the idea came from the abbot of Macheras Monastery at the time, and currently the Bishop of Limassol, Father Athanasios. He was coming into regular contact with drug addicts 25 years ago who used to go and visit the monastery. And that's how the whole idea came about. He remains to be the chair of our board and our spiritual guidance. And it's been growing ever since. Unfortunately, the need is there. So we've been developing programs over the last 20 years.
That's lovely. I wanted to ask, so now with the, like you said, with the increase in drug addiction, I've got some stats here. I just want to go over them. I just saw them 2 seconds ago. So the UN Office of Drugs and Crime report in 2022 reported 284 million people using drugs aged 15 to 64, most of them less than 35, worldwide in 2020. And there's a 26% increase over the previous decade. And then we've got for drug overdose deaths, 107,000 deaths in the US alone. And this has gone up from, was in 2021, so 107,000 in 2021. And this has gone up by 20,000 from 2020. Do you think this increase has something to do with COVID?
Yes, absolutely. Substance abuse, as I said, it's really a very, not to oversimplify, but to simply say that it's a way for people in general to find a kind of relief in their daily struggles. It's definitely the most dangerous and the most unhealthy choice. But unfortunately, every time we see issues rising in society, almost always we have an increase in substance abuse. We see this during war situations, we see this during financial crisis, and now the pandemic and the people suffering in isolation. Basically, we have seen an increase in people using substances to self-medicate, to emotionally self-medicate.
Mm-hmm. So it's as a gateway.
Exactly.
Okay.
Yeah. Availability is huge. That's another issue.
Mm-hmm.
Availability is huge. The comfort level among youth has increased, which is a huge concern of us here in Cyprus as well.
Sorry, what does the comfort level mean?
Comfort level meaning that young people are comfortable around seeing drugs. Because of the increased availability, it's not a big issue anymore. They're comfortable when people use drugs around them.
Mm-hmm.
It doesn't feel like something abnormal or out of the ordinary. And that's a major issue. People have become, not maybe comfortable is not the right word, but just careless around the substance abuse. 20 years ago, 30 years ago, in high school, you would know the couple of people that used to use drugs. Mm-hmm. These days, people will, use drugs within a peer group, and people, it doesn't upset them. It doesn't look, odd or different. This is what I mean by comfort level. Mm-hmm. And whenever the comfort level increases among youth who are usually a bit more reckless, have less impulse control, their executive functioning is not complete yet, so they make decisions more carelessly. Mm-hmm. That's when we run the risk for people to experiment. Now, I have to say this, experimentation will not lead somebody to addiction, but experimentation will get them in the door of a whole different world. So if we have a young person who's struggling with difficulties, family issues, personal difficulties, emotional difficulties, and experiments, then the substance almost makes sense inside him, finds a way to relieve him. And that's when we run the risk for that young person to repeat the drug use over and over again, because he has felt relief. So this is where risks have increased in the last decade, and especially in the last 5 years, I would say.
Okay. Could we talk a bit about the different types of drug categories and maybe some side effects, so we can talk about specifics, details. And also if you know which kind of drug categories or drug types have increased in use.
Okay. In the last decade, the whole world, including Europe, has been suffering from synthetic drugs. It's been a big issue in the field of addiction. Crystal meth, to be more specific, is a synthetic drug that has been affecting the world of substances and has been sort of like, in quotes, the pandemic of substance abuse in Europe in the last 10 years. Crystal meth is a synthetic substance who, unfortunately, does not only cause extreme addiction, it has known to change personalities. People are more violent. It's been recorded to cause secondary psychiatric diagnosis. So it really affects different parts of the brain like no other drug. Mm-hmm. So it has been a very difficult drug to deal with in therapy, to be honest. Now, the second most difficult situation we've been dealing the last 10 years again in the family of synthetic drugs, is synthetic marijuana. There's so many myths around marijuana these days and amongst youth. And that's personally my biggest concern. Synthetic marijuana also will cause a psychiatric situation, will cause psychosis. And as we have recorded in the last years that we've been studying this, first psychotic episode, it's almost 80% curable if treated properly. If people continue to smoke synthetic marijuana or other synthetic drugs and have a second psychotic episode, then the chance for treatment, for cure, drops to 40%. And after a third psychotic episode, the chance of coming out of this permanently drops to 20%. So here we are dealing with youth, young people who have been smoking, long-term synthetic drugs and end up either in psychiatric units or antipsychotic medication long-term because of this extra, I would say, impact or secondary diagnosis that synthetic drugs will cause. So we've been dealing this last decade with a more complicated situation when it comes to the new synthetic drugs. Europe has been recording almost every year 70 new of these synthetic drugs. And the way it's been going on is that people, within the drug trade, they'll slightly change the formula. The new drug remains, legal for a few months until it's spotted and becomes illegal. But it affects a lot of young people. It's much cheaper. And it's, I would say, much more difficult to deal in therapy because of its complications with psychiatric situations. This has been the new era in the field of substance abuse. So 10 years ago, in our center, for example, because it's a therapeutic community and it's a long-term inpatient facility, we used to cater for heroin IV users. I know the United States has been struggling with heroin abuse in the last decade, but Europe has been mostly dealing with synthetic drugs.
You mentioned psychosis. What is psychosis? How can someone understand they've got a psychotic episode? And what does it mean when I have long-term psychosis and psychosis as a...
Yes, that's a very good point. We need to explain it. Psychosis, it's a situation where the person dissociates with reality. And within this dissociation, the person can have symptoms like hearing voices, having illusions, getting paranoid on almost permanent basis. It's really extremely difficult for the patient to deal with all these symptoms. And in return, people become very violent in their effort to protect themselves in their own paranoid ideation. So we need to treat these people with antipsychotic medication to help them reground themselves and regroup themselves and alleviate these severe symptoms that are not that give them the sense of losing their mind almost. It resembles a lot to the diagnosis of schizophrenia. And when we say dealing with it, if we deal, early episodes of medication, people can, once they stop using the drugs, when these episodes are drug-induced, then we can have good outcomes and good results. However, if they continue to use synthetic drug substances, what we mean by long-term is that people need to remain on antipsychotic medication, sometimes for the rest of their lives, just to make sure to alleviate the symptoms of psychosis, which, as I said before, is hearing voices, having illusions, being paranoid, and generally dissociating from reality.
There's a lot of things I want to ask. I want to give an example of paranoia, and maybe you can confirm it. I was with one of my friends who did edibles, and this was the first time he was exposed to any sort of drugs, and he had I don't know if it was a psychotic episode, but he was hearing stuff that wasn't there. He would get paranoid. He had heart rate goes up. His constriction in chest. He had a panic attack, and then the paranoia was we were in the tube, and he thought someone wanted to kill him, and constantly, and yeah, it kept on going through his mind. It's very difficult to
Exactly. What we're describing, Andreas, is actually quite a typical psychotic episode where people feel afraid that somebody's trying to kill them, somebody's watching them. And it's a horrible feeling for people to feel being chased off for their life. And that's when sometimes they actually can get very violent themselves in what they think it's in their defense. But what in reality it is a complete illusion the entire time. You know that even though marijuana has been wrongly portrayed as an innocent drug, synthetic marijuana, we actually have one recorded death in the United States, in Colorado, a couple of years ago, where a college student jumped off his dormitory floor because he thought he was being chased and ended up losing his life after using edibles.
What would you say to a young person who would come up and say, well, it's okay, I use marijuana once every week, I'm fine, I've been doing it for years? What would you answer to that?
Almost always when I have discussions with young people that regularly use marijuana, if you get to the bottom of it, of the lifestyle of a young person using it, people have the illusion that it helps them concentrate. And it does give that illusion to some people that lack concentration. Or they think they're more creative. That's another myth. The reality of it is that if we have one major symptom that marijuana will cause is being, trying to find the word in English, being sitting on the couch, having goals and dreams for your life, but never putting them in action. Procrastination and always postponing for the next day. That's a status that every single regular marijuana use will admit to that. Yeah. So they have plans, they want to go on with their lives, but their life is stuck sitting on a couch, smoking and, planning for the next day. Another major symptom that marijuana will cause that people don't most of the time realize unless they go into an analysis with a therapist is that it actually locks the emotional situation of the person. So if we have a young person who might be struggling with feelings of depression, if they use marijuana, on the surface, it might alleviate a bit of that, but in actual reality, it locks the emotional situation where it is and does not allow the person to move on. So in my book, these are major consequences because people end up getting stuck. They smoke marijuana originally for fun, I guess, when it comes to young people, but regular users will almost always admit to getting stuck in situations that actually wanted to move away from.
It's interesting, and I didn't know about this. What would you answer to the other case of a young person going to university and then being offered to smoke weed for the first time? Do you consider that okay, just for wanting to see what it is, or should we avoid that as well?
To be honest, obviously, I might not be the best person to ask, even though I'm always asked. I'm on the other end of this story. I cannot ever agree to anybody trying to use any kind of drug, anything that will affect the conscious of the brain. We need to protect ourselves. There is so much going on around us that, especially young people going into college, there is so much going on. Young people need to learn to protect their minds, their developing brains, and their emotional worlds. If people are not emotionally stable and well, they cannot really deal with anything in my book. So our emotional world needs to be very well protected, and we can't play with fire. So personally, I'm completely against trying anything. You can experiment on a hiking trip, on sports, on everything and anything on this planet. It doesn't have to be with illicit drugs, or even in countries where it is illegal. And that's a whole different, discussion of why some countries choose to decriminalize marijuana. And we can actually, say a couple of things about that. But because it's a tough world out there, and because you're going through very difficult times, we need to protect ourselves, because in the case we're at a difficult period in our lives, trying something and experimenting on something feels good, then we do run the risk to repeat it. And we need to find healthy ways to entertain ourselves, healthy ways to have fun, and healthy ways to be good, to be well. So no, I am extremely against. I'm very against about alcohol using as well in the developing brain, to be honest. And we also underestimate in our country, especially in our part of the world. There was a brilliant, shocking, even for us as a professional, statistic that came out from the UK 5 years ago. A research that pointed out that regular alcohol use, not necessarily abuse, regular use between the ages of 15 to 18 will multiply your chances of becoming an adult alcoholic by 6 times. Now, that's a very scary statistic. But because it's a developing brain, and because our brains develop up until the age of 21, complicating it regularly with substances runs major risks. So I feel very strongly about the fact that our part of the world is very relaxed about alcohol use. And that to me, that is the gateway drug for young people. So we need to be very careful to follow the legal age of drinking, because most of the time it does follow the biological needs that a person has, and protects the person from having this kind of interference in their development.
What about in the case of parents, when you have a parent, let's take alcohol, for example. I'll describe 2 scenarios and you can comment on them. One scenario is the parent is very strict. You won't have alcohol until you're 18. And they're very strict with this, and they enforce it on their children. And in the other example of the parent describing, okay, alcohol is bad for you, you shouldn't have it until you're 18, but it's okay if you try some. Here on the table, you try some wine, or the kind of culture I'm talking about. Here you can try some beer, it's okay, he's 17, he's 16.
I will go with the first scenario. I strongly believe that we set the example of our children from day one until they leave the house, they leave the family, and they leave the home. So parents need to set that example. So alcohol needs to be contained within family occasions, within celebrations. As a parent who raises children, I would suggest to avoid the daily use of alcohol and to be very clear of why we need to reach the adult age before you use alcohol. Just like smoking, just like driving. You won't tell your kid to drive around the neighborhood at 15 to give it a try because of the dangers. To me, it's exactly the same thing. So parents need to set the example. Parents need to be able to contain themselves when drinking, to set that example. And parents need to clarify to their children, when they raise children, that when the right age comes, then they are entitled to try alcohol. And also, it's a lesson that we teach our children to remain within the law. We don't do anything illegal, both parents and children, so that we raise people that have the set of values and respect laws within their homes and their countries. So no, I would not encourage experimentation before the legal age of alcohol. In Cyprus, it's 17, and I will educate. Parents need to educate their children of the risks that this entails, but most importantly, they themselves need to set the example.
I was going to ask on how they would pass on this message, and I think setting the example is, you addressed it very well. You mentioned decriminalisation. So is that good? Is that bad?
Yeah, well, it definitely, a country before it makes that decision needs to study very well and research the conditions of the specific country. And I'll give you the example that I found very interesting and very precise to what I'm trying to point out. A few years ago, Chicago was one of the states in the United States that decriminalized marijuana and made it legal. And I remember listening to the interview that the chief of the police of Chicago gave. And he said, when he was asked about it, he said, when I am investigating 7 homicides in one neighborhood, I cannot be chasing after a marijuana user. So we need to be very careful why we make the choice to decriminalize within a country. What are they? We can't look at Chicago and say, oh, they've done it, so why don't we do it? So we need to be very country specific when we make that decision. To be honest, Holland, who set the first example years back when it was first made legal in the Netherlands, the following year, interestingly enough, their heroin use had increased immensely. The last 5 years, they're really trying to contain marijuana use in the Netherlands within licensed users. So it's not black and white. What I would say is that any country who will move forward, they need to be very careful to study, and research deeply what's the reality of the country and whether that country is ready and whether the damage that will be done will be more than the benefit. Because we casually say, well, when something it's not when something is forbidden, it's more attractive. Well, alcohol is not forbidden in our country, and right now it's the number 1 substance of abuse in Cyprus. So it's not a straightforward answer for me. I'm not for it, obviously, since, like I said, I've been living for the last 25 years these consequences. But I would just say that any lawmaker who will move forward to such a decision, they need to take into consideration every single element within the country.
So address the complexity and uniqueness
Exactly.
of each situation.
Exactly.
And I think it's the same way that goes with patients. Not all patients will continue with the same treatment plan. It's very interesting, all the stuff that you're saying. Let's move on. So we talked about cannabis, which is something I wanted. Is there any other myths around the use of cannabis that you would like to address?
The one thing that I quickly mentioned before, that there's a huge myth about creativity. That's why marijuana is very common and widely used amongst the arts. There is one of the largest organizations of substance treatment in the United States, the Phoenix House, has actually created a teenage program that involves a music school and with recording studios and drama school, and caters this youth just to point out that creativity is not associated with the use of marijuana. And it's actually a college within the substance abuse treatment program within the arts, just to prove the opposite. The fact that it's been tried to portray it as innocent, when you live and when you work with people that have gone through psychotic episodes because of synthetic marijuana, then you realize not only that it's not innocent, but in my book, probably one of the most dangerous ones that will mess with your brain in ways that can bring about damages that sometimes are irreversible. Also, some of the myths is that medically it's been helping out on a lot of diagnoses. Now, that is not proven. There are still studies being made. What we have proven this far is that it will alleviate symptoms for some medical diagnoses, but definitely will not treat diseases, major diseases, like it's been
portrayed.
Yeah.
I was going to ask about, and you addressed the question before I had the chance to ask. You mentioned synthetic marijuana. What's the difference between synthetic and non-synthetic marijuana? And is non-synthetic okay then?
Synthetic marijuana is marijuana that's been processed with chemicals,
Mm-hmm.
different kinds of chemicals. Non-synthetic marijuana will have less complications, but people that are predisposed to some psychiatric situations genetically also run the risk with non-synthetic marijuana.
Mm-hmm.
What's most risky in this situation is that nobody, even the most experts that consider themselves expert in regular uses, cannot tell them apart. So you never know what you're purchasing when it comes to synthetic or non-synthetic marijuana. So that alone increases the risk immensely. But in terms of the deeper consequences that comes with what we mentioned earlier, being, undecisive, stuck on a couch, not moving forward with your life, that applies to all kinds of marijuana use.
Correct me if I'm wrong. I was reading this study, which is the two main ingredients in marijuana. One is CBD, and then the other one is THC. THC is the psychoactive ingredient. And I was reading that in the past 20 years, the ratio usually was CBD was 80% and the THC was 20%. And these ratios have changed. So the CBD substance has lowered, and then the THC has increased dramatically. And they do this because it gives more of a high, a stronger high. And because, and the idea was, again, correct me if I'm wrong, that CBD kind of countered some of the side effects of THC.
Mm-hmm.
And because of this reversal in the amounts of the substances, then we're seeing more and more psychiatric and psychotic episodes.
Mm-hmm. That's exactly right. However, we have no clear results on these studies to be specific about to have a conclusion.
Mm-hmm.
It is true that the increase of THC concentration is what's causing most of the side effects, and that's why CBD byproducts are legal. However, we do see, though, that within the population that uses and abuses marijuana, it's a mix and match. They do combinations of things, and that's when things get complicated and risky, and that's why we can't have clear conclusions yet.
Let's move to some other drugs. I think we've addressed the cannabis use very thoroughly. So we talked about CBD oil there's not much evidence behind it. Well, no concrete evidence for it to be used in alleviating symptoms, for example, palliative care. What about ketamine for depression?
There are new studies coming out in the use of both ketamine and also hallucinogens in the treatment of major depression. To be fair, so far the first results are positive, inconclusive yet, but they're under study, and I do believe that this will bring us to a new era of dealing with major clinical depression. However, whatever use we do of substances, it needs to be medically supervised and medically guided. So again, I'm a bit wary for people to experiment on their own and to abuse substances in order to get better for other diagnoses. We have a world of ways to clinically and medically deal with depression. And it's a very serious diagnosis. And I think that I would feel much safer if it's done within a clinical setting and with the help of a psychiatrist rather than using substances to alleviate symptoms.
I think it's very important. It doesn't mean because you feel down, it's okay to take some mushrooms.
Exactly. It's been a myth around alcohol all these years that, you take alcohol and you feel happy. You feel happy in the first couple of hours of using it, but alcohol is a depressant and it will contribute majorly to people that are depressed. So it's been a vicious circle for these people all their lives. Again, because of the misconception that a bit of alcohol will help you enjoy yourself more.
So let's move on. How do you know you need help with addiction in any of these substances we've talked about? And where should you reach out to get it? We can talk about Cyprus or US, UK.
Okay. One of the biggest difficulties in the field of addiction is that people control their drug use for a very long time. So the day that they will move from drug abuse to drug addiction, which most of the time it's a day of no return in terms of being able to deal with it without treatment, we don't know when that day will come. I've seen people that have been addicted to substances after 3 months of using them. I've seen people that got addicted 3 years after using them. I've known people that died the second time they used the substance. So it should never, the moment the substance becomes center of somebody's life, and the moment the person is finds themselves too regularly using something, I would say that's the time when you need to ask for help. Experimentation, drug use, and drug abuse are 3 stages that a person can go from one to the other. But like I said, the day that your next substance abuse will take you into the addiction phase, will be a very difficult road to come back or to deal with it without treatment. Now, I always say to next of kin, if it's a parent, a partner, a sibling, a husband or wife that realizes that there is substance use going on, any kind of use, is to reach out for help. There's no need to panic, but because usually we don't find that the actual person who's using will ask for help until they're really at rock bottom. So we advise the next of kin or whoever is close to a substance user, the moment they realize there's regular substance use, to reach out, ask for help, and get the professional instruction of how to go about it. Sometimes I tell people that, ask for your, for the person who's using, ask them for a favor, see a professional just one time, no commitment, to engage in the conversation, to help them question what they're doing and where they are at. It's not easy because you can't force somebody into therapy. You just need to help them and motivate them understand the consequences that they are dealing with as a start. In Cyprus, we now have a lot of outpatient programs. We have been able, after years of struggles, to pass a law that has been active since 2017, where that allows the judge to order treatment instead of imprisonment. Because either we like it or not, drugs are illegal, and regular users will end up in trouble with the law. So we're able now, both for teenagers and for adults, to be given the opportunity for treatment instead of any other kind of punishment within the court system. So we do have a lot of court-ordered clients. They're not, I guess, willingly there, but it's a start.
Is there a telephone number that they call?
Yes. Our number here in Cyprus is 22347720. So 22347720. They can call our number and we can evaluate and refer out either to our program or to other outpatient programs. Because to need an inpatient program, we cater for long-term users. But we can also evaluate and refer out to other outpatient programs.
What about the percentage success of long-term abstinence of people coming out of therapy? And I do want to, we don't have a lot of time, but this, it's very interesting. I don't want a few words about what kind of treatment happens in the therapeutic center of Agia Skepi.
Okay. Agia Skepi runs on the model of therapeutic community. Therapeutic community is actually a treatment model that originated in the United States, came in Europe in the early 80s, and we have actually copied that model. We have adjusted it to our country and our culture, and we have also incorporated in our efforts a spiritual component to it. Because we do believe that a person is both, physical, mental, and spiritual, and you need to cater for all of that. We have a very holistic approach to that if we require people to change their lives all over. We have very, very good outcomes. I would say roughly 1 in 2 people will make it. Our success rate is 52%, including those people that drop out. If I look at the people that have completed all phases and graduated from the program, our success rate is more than 70%. Now, internationally, therapeutic communities have a success rate of 20 to 30%. So we're very grateful for our results. Why we have such high results? We're a small country. We still have values, the value of the family. We have family programs and we support the family in that way. And I do feel strongly that the spiritual component we allow people to explore within therapy and their connection to God and to choose, if they want to, in their free will, a life within the church and to have a spiritual component in their everyday life, then we do see the way forward much easier for these people because you provide for them another support system. These are people, long-term drug users. We need to note that long-term drug users are people that have been using drugs for 15 to 20 years. The people have had it very rough. They're people that have been imprisoned. They have they have a heavy history of illegal activity, substance abuse, dissociation from their families, and a lot of personal and emotional pain. They need to have hope, to be forgiven, to have hope to be taken care of and to care for others, to have hope that the person next to them and allowing God in their lives will cleanse them and help them out in stepping forward and building a new life independent of their age. Average age of people at Agia Skepi is 35 to 40 years old. And yet these people start from zero and they build families, they start working and they have normal, healthy lives. For someone to come to us, because they are long-term drug users, they will stay in the program for a year inpatient and then another year outpatient, year and a half almost. So for 2.5 years, they'll be working on themselves emotionally, getting psychotherapy and getting all the support needed to reintegrate into society with new tools to deal with everyday life.
That was amazing. I have to say, I've witnessed this metamorphosis of people going from zero to having nothing to people having full lives with kids, families, secure jobs. And it's truly very, very hopeful because there's no point where you can say there is no point of return. There is always something that can happen.
Exactly. I want to also point out that the therapeutic community, the way it's run entirely by the clients. And we try to provide within the setting an alternative family. It's a family environment where each will help the other one. It's very interesting that this model resembles very much so a community, a spiritual community, or a community, I would say, where practices within the Orthodox Church we have a lot of common in that way. And I'll point out a couple of things. Within our community, most of therapy is done in group therapy. Group therapy is sharing your experiences and getting some support from each other. It's almost a way to confess what you've done in your life. At Agia Skepi, we have a spiritual father who visits once a week, and people at their own free will, and I find it extremely interesting that almost everybody will have either a talk or a confession session with the spiritual father that visits, because they need to cleanse, the need to start from the beginning is there. So that is a tool that resembles therapy, but also brings it to another level. At Agia Skepi, even church going is optional. So people, if they choose to attend church on Sunday, they'll sign up on a list on Saturday evening, and we transport them to the monastery, which is pretty close to us. And I always find it amazing the amount of people that will sign up on a weekly basis because of that need. The need to turn to God and ask for His help, and ask for repentance, and ask for, to feel strong again and do the right thing. The only other practice that we do that also within treatment is quite appropriate, but it's also an orthodox practice, is fasting. We do maintain the fasting periods within the orthodox calendar because we find that self-restraint is what we're trying to build within these people. They've lost their self-restraint within their drug use. So if on Wednesday and Friday, and if during Lent, I restrain from certain foods, I increase my ability to restrain from things that I used to be, abusing. So we find that fasting is a tool that helps people a lot to build more self-restraint. So we're able, confession and fasting has been the two main tools we've maintained within the therapeutic community because we found they resemble so much, they assist in treatment. And of course, a basic and simple prayer before every meal, because we do need to be grateful for what we have. And again, it's at each person's free will to choose a spiritual life. Some people don't and some people do. But we do notice that people who do choose to have a spiritual path, their treatment runs much smoother than everybody else.
That was amazing. Thank you. I think let's give out a message on either to young people doing drug abuse right now who are listening to us, who haven't done drug abuse. Do you want to separate them? Okay, let's do one for people who are currently in drug abuse.
Okay, people that currently use drugs, I encourage them to either stop if they can, because they have their whole life ahead of them, and whatever the difficulty is today, there is no difficulty in this world that cannot be dealt with, and that cannot be dealt with it without drugs. So the message of hope is that whatever the case is, we can deal with it, and they need to just reach out to a friend or a family member and ask for help, and help will be given. And there's no issue in this world that cannot be addressed and dealt with it, whether it's family issue, personal issue, or substance abuse issue in the end. To people that have never used drugs, it's too much of a risk to take. I've lived for 25 years on the other end. I've lost clients, meaning, clients of ours have died within the substance abuse world. It's never an answer to any problem. And I would encourage people to not even experiment, not even try, because there's really no point, to seek healthy ways of entertainment, to seek to express themselves, to deal with their emotions, and to seek emotional help through their friends and family, and professionally if need be.
And a last message to parents dealing with children.
Parents dealing with children that have already been experimenting or using drugs, there is no need to panic. I would encourage parents to refrain from, using their own methods to deal with it, and to ask for professional help. It's very important. People, and understandably, will panic and use force or constraints that are almost never any results. So for parents who kids are already in substance abuse, I would highly encourage them to ask for help. Now, for parents whose kids are not using any drugs but are afraid because of what's going on in our societies, I would say that you need to have one concern about your children. Make sure their emotional well-being is stable. Make sure that emotionally they're healthy. make sure they get all the help they need emotionally. We tend to oversee the emotional needs of our children, and we tend to focus on their GCSEs, on their exam results, on their college plans. These are all great, but for them to be able to cope with all this, they need to have a good emotional well-being.
Thank you so much. I think today has been enlightening. It's been very hopeful, a very hopeful message, and I've enjoyed it immensely. Thank you
Me
so
too.
much,
Thank you.
Tina.
Thank you for inviting me.
It's a pleasure.